Welcome to the Fascia-Informed Therapist, the essential podcast for occupational therapy professionals looking to deepen their understanding of fascia's pivotal role in therapy and health. I'm your host, Amy Mayer, an experienced occupational therapist, practice owner, and dedicated educator. Here we'll dive into the fascinating world of fascia, exploring its significance in the human body and its critical influence on occupational therapy practice. Each episode will bring you cutting-edge insights, expert interviews, and practical strategies to help you confidently integrate the science of fascia into your therapeutic approach. Whether you're a seasoned practitioner or just starting out, our goal is to equip you with high-quality, evidence-based, and fascia-informed continuing education opportunities that will enhance your skills and benefit your clients. So join us as we unravel the complexities of fascia and transform the way you practice occupational therapy. All health and wellness practitioners are welcome. Let's learn, grow, and evolve together. Hi, this is Amy, and this is another edition of the Fascia-Informed Therapist. And today's going to be a bit of a quick one, and I'm posting this a little bit late. The reality is that it's been a busy couple weeks. It's been a busy weekend, and I'm a practicing therapist trying to run a business, well, two businesses, mentor a therapist. We have a student coming in a week. Oh my goodness. And I'm trying to see anywhere from 8 to 15 people a week. It just depends. And I know that sounds luxurious when many of you are seeing more than that in one day. I had somebody tell me not that long ago that they knew people that were required to see 20 people in a day in lots of different kinds of settings. Anyway, I get the reality of what's going on out there, and with insurance and reduced reimbursement, and I'm removed from that, but I'm very aware of what's going on. And that's one of the reasons that I really want to get this information in the hands of practicing therapists, because I think it'll be helpful. I think it'll be helpful to you for your own body and to the clients that you serve. And when I say get that to you, I mean the understanding of the science of the fascial system and different ways to treat people to be as efficient as you can, but as effective as you can as well. So what am I going to talk about this week? It's not going to be a heavily referenced session like the blood pressure or the cupping that I did recently. It's just going to be some thoughts, some things that came up. And it's not going to be a video version because, frankly, it's been a busy day and I did not want to set up the camera and make myself presentable in that way. I've got a sweatshirt, I've got a cap on. It's just one of those days. And the beginning of the year is also when I'm not really a New Year's resolutions person, but it's typically when I get my blood drawn and I do whatever tests I'm supposed to do and meet with my doctor and just get all that stuff done. So I've been busy doing a lot of that kind of stuff, and there's more of that tomorrow. So anyway, I try to take care of myself, and I'm not a super duper fan of some traditional methods, but I think it's still a very important component to your health. So anyway, what am I going to talk about today? This came up in a session that I was doing with a therapist who was working with me one-on-one. So I do continuing ed in-person events for people, and then I have my online, but I also do one-on-one. You can call it coaching, I guess, if you want to, online or in person. And those are so fun for me because this particular therapist just completed the science class and now is coming to learn some in-person things. And she's doing a lot, growing some programs in her place of work, and has some really cool opportunities to do some cool stuff. So anyway, we were talking and it came up. The question was, how do I think about which direction I work on somebody? And this comes up a lot when I do in-person the group style CE stuff. And I think ultimately what you do is between you and your client. There's not a one right answer for everybody, right? But when you have knowledge of the fascia, or you are fascia-informed, you might think about it differently. But I'm going to start here. I'm going to start with, if you haven't worked with me before in terms of as a client or coming to a CE that I do, I'm passionate about getting fascia-informed techniques, and that includes myofascial work, in the hands of practicing therapists in traditional settings. Because I think, as I've talked about in other episodes, there's some stigma. There's some, not stigma around some of the techniques out there. So I want to get therapists to pay attention and know that it's not just about myofascial release. It's about the whole system. And it's the whole system that's going to help us do a whole lot more things for our clients. But this therapist was there to learn some technique for the type of clients that she works with. And she frequently works with people who are post-surgical. She specifically brought up things like carpal tunnel and shoulder surgeries. But a lot of this holds true, I think, whether it's a surgical, post-surgical something or other, or if it's just an acute type of a pain that somebody's having. Okay, so before I start talking about, well, what do I do? Can I work on that? Can I work near it? First, I want to explain that when I practice myofascial techniques on clients, I am typically using one hand at a time. And I do that to preserve my own body. And I do that to preserve your body when I'm teaching people. Because if you're going to do, especially what I do when you're doing myofascial techniques with every client that you see, sometimes for most of their session, you got to work up some stamina. You got to work up some serious stamina. And you need strength as well, but it's more about the stamina than the strength because it's a gentle technique. But depending on the person, you might need a little bit more strength. So a one-handed technique allows me to turn my body in different turn my body in different positions, different directions is the word I was looking for, so that I use slightly different muscle groups as I maintain my pressure into the resistance. Because if I'm using two hands, I've got nowhere to go with my body other than exactly where it's at. And even though I've maintained this stamina for several years now, I mean, I've been doing it for 30 years, but the last 7-ish now, almost 8, full time. So I still can't I occasionally do cross hands, but I can't do them very often. So one-handed technique, you can still find that resistance. You can absolutely still find that resistance and move into the restriction and get the release. 100%, it works great, it preserves your body. And it's sometimes you can do it more easily with people who have clothing on, who maybe have a gown on, and you just don't need access to so much skin. You just need access to enough skin that you can get your palm on there and move through whatever area you're working on. Okay, so that's the first thing to think about. The second thing to think about is when you've got somebody with something that's more acute, you need to understand what their restrictions are, and are they released for good movement? Can they move that area well? Can they move it without pain? Can they, what is happening? Can you get close? Like if it is a shoulder issue, can you work right across the shoulder? You need to fully understand that first. But if you are questioning it at all, then do not work right on top of that area. The next question is, okay, well, how can I affect it? Well, one, we know that the fascial system is a whole body system, right? And if we can say, well, you can have tension in your hips and that can cause a problem in the shoulder, well then if we have a problem in the shoulder, we can work lots of other places in the body, release that tension in the hips perhaps, and then maybe we'll see some relief in the shoulder. Now, I have clients who are pretty acute from lots of different kinds of things, and I work far away from that particular area just to be safe. But because, we got to keep the whole rest of the body okay. We got to keep the tension from building up in the rest of the body, maybe while they're less mobile when they're post-surgical or when they're recovering from something acute. So the other thing to think about is if you feel comfortable getting closer to that area, work toward it. And when you're using a one-hand technique, you can work toward it. So if you take the example of the shoulder, then start down at the forearm and do your release in the direction of the shoulder. Put your pressure in the direction of the shoulder. And theoretically then, if you take tension out of the forearm, you should see less tension in the whole system, especially closer to where you're at. And then just keep working toward the shoulder. And then if they're laying on their back, you can work on the chest toward the shoulder. You can work on the upper trap toward the shoulder. If you can get them on their side or face down, you can work on across the scapula, on the rib cage toward the shoulder. Guarantee you if you do that, you'll probably get some results because, man, that is always seems to be a magic spot for a lot of people. I see the same thing, the same idea when I have somebody with a plantar fasciitis or that heel pain. And when I work away, like I'm going up the calf, that can pull into it and kind of be irritating to some people. And so I typically work toward the foot, toward the heel. And that works amazingly well. Now, if I work toward the heel for a while, and then I might test and see if I work away from the heel, up toward the knee, how does that feel to them? And if it feels okay, then I might also do that too, but I'm probably going to work toward it first. So that is just something to think about, especially for you practitioners who are working in settings where you're working with people who are more acute. And I feel like I have to say this too. If you've got people who are going in to get carpal tunnel surgery, get shoulder surgery, have a mastectomy, have whatever done, working on the body and to prepare for that surgery is amazing as well. And I think I have a whole nother podcast on that somewhere along the line. But that's just something else to throw into this thinking mix. So if you're not familiar with doing one-handed techniques, try it out. If you're a practitioner who does myofascial technique, try it out. See what kind of results you get. Try it on your friends and family if you don't want to try it on your clients. But I can tell you, my clients are always up for what you got next. What are you doing? What are you thinking about? What are you reading? Tell me what's going on. They're always up for trying something new with me anyway. And I'm sure that's different for everybody. But anyway, that's where I'm going to stop. Thank you so much for listening and being patient with me being a little bit behind this week. So everybody have a great week. Thank you for tuning in to the Fascia-Informed Therapist. It's been a pleasure sharing insights and strategies to help you integrate fascia science into your practice. I'm Amy Mayer, and I hope today's episode has inspired you to explore further and take your therapeutic skills to the next level. Remember, we're committed to creating and providing top-notch, evidence-based, fascia-informed continuing education that empowers you as an occupational therapy practitioner. Stay connected with us for more enriching content, and don't forget to check out our online courses to deepen your expertise. Until next time, keep expanding your knowledge, refining your skills, and confidently applying the science of fascia to your practice. Here's to advancing together in health and wellness.